Hi, everybody. Dr. Daniel, and today I'm talking about amitriptyline for nerve pain. Amitriptyline is the generic name of Elavil, and it came out in 1961 in dose sizes of 10, 25, 50, 100, and 150 milligrams. And the FDA indication has always been for depression, but amitriptyline has been found to have many other uses. And I just Googled uses of amitriptyline in the internet, and this is what I came up with. I'm going to read you this list. So I'm going to discuss other uses of amitriptyline, and we'll see what we got. So one thing it's used for is low mood. That refers to persons with decreased mood. They seem unhappy, but who are without the full DSM-5 symptoms of depression. It is also used for depression. And this group of patients who have the full DSM-5 symptoms of depression, it's used for anxiety. And anxiety refers to someone who is worried to a certain degree. And all life has some degree of anxiety and worry. Anxiety may be expressed, though, as a generalized state of muscle tension, headache, and trouble sleeping. Panic disorder. That refers to specific attacks, usually lasting less than 5 minutes, with symptoms of trembling, trouble breathing, chest tightness, and dizziness. And the patients during that time complain of feeling frightened and have been filled with terror. Post-traumatic stress disorder. These are symptoms that occur after exposure to trauma. These symptoms may be unwanted, upsetting memories, nightmares, or flashback events. They may have trouble concentrating, trouble falling or staying asleep, or may feel irritable and experience angry or aggressive outbursts. Pelvic pain. This group is a diffuse collection of different gynecological problems, whereas the patient presents with pelvic pain. Polyneuropathy pain. This is generalized polyneuropathy, not specifically diagnosed, but it commonly has pain with it. Chronic neuropathic pain. This is another rather vague, nonspecific group of patients. Painful diabetic neuropathy, perhaps the most painful neuropathy of the group. Postherpetic neuralgia. This refers to burning pain following herpes skin infections, also called shingles. The pain may be severe when it is in the face, as in postherpetic neuralgia, the seventh nerve, or with pain around the eye and associated with seventh nerve palsy, which is also called the Ramsay-Hunt syndrome. Trigeminal neuralgia. This is neuralgic pain which comes with intense salvos of shocking type pain in the face and the sensory distribution of the fifth cranial nerve. Phantom limb pain. Phantom limb pain. This occurs usually in the arm following traumatic or surgical limb removal. It may also occur following leg removal. Postoperative or traumatic neuropathic pain. This is worse following sensory nerve involvement with a surgery or trauma. Complex regional pain syndrome. This causes chronic pain in an arm or leg which develops after an injury, stroke, heart attack, or surgery. The pain seems to be out of proportion to the severity of the initial injury. And the occurrence of this must be rare because in 50 years of practicing neurology, I think I only saw 2 cases. Guillain-Barré syndrome, more specifically named chronic inflammatory demyelinating polyneuropathy, CDIP. And there's typically a radicular pain early on during the syndrome, which may later clear. HIV neuropathy. HIV damage to nerves throughout the body causes pain. Spinal cord injury. Pain in the level of the cord damage alone, or also in the trunk and legs below the band of involvement. Fibromyalgia. Fibromyalgia may result in chronic pain in multiple sites, such as the head, arm, chest, abdomen, the leg, upper back, and spine. The pain may be mild to severe. Pain from arthritis. Arthritis is really inflammation of bony joints, but there may be pain, stiffness, warmth, and redness with this. And amitriptyline has been used for all of these disorders. So good luck with this. Hope it's helpful. Please click and like down there. I'll see you again on the next talk.